All right, hey everybody, Dr. Hagmeyer here, and if you're just joining me, I want to welcome you to my website, and if you're watching this on YouTube, my YouTube video channel, then I hope you enjoy my channel, and I hope you become a subscriber. Today I want to spend some time talking about the TSH test and why, when ordered by itself, or sometimes even in conjunction with a free T4, why it's an incredibly misleading test. Okay, I realized that after shooting my last video titled 12 Symptoms of Low Thyroid that indicate a need for a full complete thyroid panel, that there was just way too much information for us to get into, and I realized that I didn't get a chance to talk about a lot of these different things. So in today's video I want to kind of unpack those areas and dive into what those areas will be. So number one is that there's four main areas I want to get into and review with you today. Number one is why you can't rely on TSH and explain some of the shortcomings of this test. Number two, I'll talk about the specific markers that make up a complete thyroid panel and where the ranges for those markers, those biomarkers, should fall. We call these functional thyroid lab ranges. Number three, I'm going to talk to you about some of the additional lab biomarkers that, while they're not part of a thyroid panel, they really should be run when your thyroid markers are run, because these biomarkers will without a doubt influence your thyroid levels, and that in itself makes them very important. Number four, I'm going to talk about some of the most common causes or the conditions where the TSH is less than the reference range, but a person is still very hypothyroid. All right, so let's jump into this. Let's get started here. All right, so as you know, one of the most widely used lab tests that is used to evaluate thyroid function is the TSH test. However, it's also important to understand that it is also one of the most misleading thyroid tests out there when it comes to ruling in or ruling out a thyroid problem. Okay, I review, I don't know how many thousands of blood tests on a yearly basis, and I review patients testing every single day where thyroid markers, and one thing I have to say is that I'm absolutely amazed at how many patients, when they submit these blood tests for my review, have all the symptoms of thyroid disease, yet the only marker that was ever run was, you guessed it, a TSH. All right, so TSH stands for thyroid stimulating hormone. Okay, it's made in the brain. Its purpose is to stimulate the thyroid gland or instruct the thyroid gland that it needs to make thyroid hormones, right? Unfortunately, doctors have continued to put way too much emphasis on its importance in ruling in and ruling out these thyroid diseases. If you're a person who has noticed that you have all of these thyroid symptoms, again, I'm going to list them for you: fatigue and weight gain, anxiety or depression, brain fog, maybe hair loss, maybe you're cold all the time, or maybe you're hot all the time. Maybe you're gaining weight, losing weight. Maybe you've gone on a low calorie diet. You're not losing weight. Okay, for whatever the reasons, you went to your doctor, and your doctor runs this TSH test. Okay, maybe if you're lucky, they also run this free T4 test. Now, what if I told you that there's so much more to this thyroid story than just the TSH and just the free T4? What if I told you that a normal TSH may not be so normal? All right. As you can imagine, it can be quite confusing, right? How is it possible that you can have all these symptoms, but yet, get a call from your doctor or from the doctor's nurse saying that everything is normal, right? What if many doctors find even confusing is that when a patient is diagnosed with low thyroid disease, or what we call hypothyroidism, they receive thyroid replacement. Maybe it's Synthroid, maybe it's levothyroxine, maybe it's Armour, maybe it's Cytomel. But yet, after all that replacement, this patient still experiences all of these symptoms, okay? How is that possible? Well, as you can see from this study published in one of the medical journals in endocrinology, and you can read the title, it says, "Why are our hypothyroid patients so unhappy?" The journal goes on to say that a large number of hypothyroid patients receiving adequate doses of thyroxine supplementation continue to complain of dissatisfaction and varied symptoms. Quote, okay, "I don't think that any doctor or patient in the United States would argue with this conclusion," right? As you can see, those who receive thyroid replacement often don't feel better, and they continue to suffer with symptoms, and yet those patients who have the symptoms are the same patients that are being told that everything is normal, right? So I don't think it comes as any surprise, and it's certainly a dilemma that doctors are experiencing, that this is a pretty messed up situation, right? We have people that are very sick and people that just want to feel better. So let's jump into why this is happening and what you can do to get the ship on solid ground, so to speak, all right? All right, so in order for us to understand if our thyroid levels are normal, there are a few things that we first need to understand, right? To start with, in order for us to have an intelligent conversation about the thyroid, you have to have a complete thyroid panel, all right? So that's step number one, okay? You have to get a complete thyroid panel. Only after you get this complete thyroid panel can we now begin to have the conversation of why do I have a thyroid problem in the first place, okay? I should also say that having a thyroid test that shows that you have low thyroid still does not tell us why the thyroid gland is not producing sufficient amounts of T4 or sufficient amounts of T3. So I want you to keep that in mind, okay? While these tests are very, very important, they don't tell us the why. They tell us that we have a problem, all right? So, for example, these tests will show us if you have low T3, if you have high reverse T3, if you're not converting your T4 into T3. But again, we have to understand that the shortcoming of all this is that they don't tell us the why, okay? For you to do this, okay, you need to have a doctor who understands functional medicine and a doctor who has the experience in understanding what kinds of tests are going to show you why that reverse T3 may be elevated, or why that T4 is not getting converted into T3, or why that T3 is low in the first place. Okay, so just keep that in mind, that restoring function back to the thyroid gland is much more than just giving thyroid replacement, okay? It doesn't fix the thyroid gland, and even though it may alleviate some of these low thyroid symptoms, in the long run, it's not going to fix it. It's not going to revitalize the gland. And that should be really the number one goal, all right? The goal of any treatment should be to support and revitalize the body so that the body makes sufficient amounts of thyroid hormone, okay? Not simply putting a Band-Aid by taking thyroid replacement or taking T3 and shortcutting the process, okay? That's what allopathic medicine is really good at doing, okay? It looks at what levels are high, what levels are low, and then tinkers around with the dosages so that the numbers look pretty on paper. And again, in the long run, you're still sick and you're not fixing the problem, and you're just going to get sicker in time. So again, it's important to know that. So what is this complete thyroid panel, and what are the thyroid ranges, and what are some of the reasons why this TSH can be misleading, all right? So let's say that you are convinced that something is wrong with your thyroid, but every doctor says your thyroid's normal, right? And they're just not listening, right? What tests do you need, and how do you interpret the test results? Okay, number one is you need a free T3 test. I like to see these levels between 3 and 4. Very often people are prescribed leothyronine or Cytomel or some combination of T4, T3 with the hopes that this is going to elevate the free T3 levels. Now what happens is the sudden rise in T3 that people will often get from taking this thyroid hormone will initially make you feel great in some cases, okay? Some people not, but in some cases you'll feel good when you start to bump up these T3 levels. But very quickly the good feelings are followed up with the anxiety and the insomnia and the heart palpitations and the heart racing and the inward trembling and the racing thoughts and the hot flashes, and even some will experience weight loss, which again, sounds like it's a good thing for some people, but again, it's not, because in the long run, you're damaging the thyroid gland even more, okay? So think about it this, is that when your thyroid levels spike up due to some sort of T3 replacement, you're going to have the symptoms of hyperthyroidism, okay? But again, and this is very important, in the long run, when your T3 levels or your free T3 levels remain elevated, it's going to suppress the pituitary gland's release of TSH. So what winds up happening now is you have both T3 and T4 that are sometimes elevated, and now you have a low TSH, okay? And now you start this roller coaster of feeling fatigue and brain fog and depression and hair loss and weight gain, etc., okay? This is what I call the thyroid roller coaster, okay? I've referred to this in some of my past videos, but this is the scenario, again, where every time you go to your doctor, your TSH is up, and then it's down, and your doctor increases your thyroid medication, you feel a little hyperthyroid, and then it's back to being down again. So the next marker is a reverse T3. This is the second marker that becomes very, very important in a complete or a full thyroid panel. It's very important that you get this reverse T3 levels, and what you want to see is you want to see these reverse T3 levels less than 15, okay, without an exception. If your free T3 is high and your reverse T3 is also high, then a couple of scenarios could be happening, okay? Number one is your ratio of T3 hormone in the medication that you're taking, it's off, okay? You're taking this thyroid replacement and you're taking too much of it, okay? You are undergoing an unhealthy or overwhelming stressor in your life. That's another reason why these reverse T3 levels will go up. Another scenario is you have inflammation in your body, all right? Maybe there's an underlying infection, maybe there's an underlying stressor, maybe there's oxidative stress, maybe there is an underlying rheumatological condition like rheumatoid arthritis or psoriatic arthritis or some sort of inflammatory connective tissue disorder. Okay, these are also things. Maybe you're in a lot of pain, maybe you have migraines. Okay, these are all things that can cause the reverse T3 levels to go up as well. Again, we mentioned things like oxidative stress, and then also insulin resistance is a common scenario here. Now, the reason why you want to get a reverse T3 level as well as a T3 level is because if you visit my website or you just go into Google and you type in T3 reverse T3 calculator Dr. Hagmeyer, you can punch in your values there and it will automatically calculate what your T3 reverse T3 ratio is. And your goal should be to see that level above 10. Okay, that's very important that you calculate that out, and there's a video there that explains again the significance and the importance of all that. The next marker, of course, that you want to get is your total T3. Okay, you need your total T3 because that total T3 will be divided by your reverse T3. Okay, so again, the total T3, I like to see these levels, and I find that most patients, when they look at their thyroid levels and they compare, how they're feeling, I would say that most patients find that anything between 110 and 150 is where they actually start feeling pretty good. Okay, the range for your total T3, the functional range that is from 100 to 180. Okay, but again, that sweet spot that I just find most people feeling the best in is again anywhere between 110 and 150. All right. Over 150, I'm starting to ask about things like anxiety and heart palpitations, maybe some insomnia, maybe again feeling hot all the time, maybe feeling on edge or a little bit of irritability. So again, that T3, if it's too high, will cause all those symptoms of hyperthyroidism. Now, one thing I try to tell people, and I'm going to tell all my followers here on YouTube or even on my website, is that one piece of advice that I would give to you is that every time you have those levels run, it's very important that on your lab report you write down perhaps some of the symptoms that you're noticing have improved, how you're feeling in general. So how are you sleeping? How are your energy levels? How's your gut feeling? Do you feel more irritable? And you want to try to compare that to where your T3 levels may be, all right? Because here's the reality. Everybody's T3 levels and their requirements are going to be different, okay? One person might feel terrible with a T3 level of 130. Another person might be feeling the best at that same level. So here again is where you need to take a little bit of a responsibility and write down on your lab sheets and your lab reports where you feel. Again, it's very, very individualistic. So again, write down the symptoms, write down how you feel. The next marker that becomes very important is your free T4 levels. Again, this is a test that is sometimes run with the TSH by your primary doctor. Again, Synthroid and levothyroxine or any other thyroid replacement that contains T4 or a combination of T4 and T3 can also influence these levels and make these levels go up. All right, so that's important to understand. I like to see these levels between 1 to 1.5. A low free T4 without being medicated indicates what you would expect, that your thyroid is simply not producing enough thyroid hormones, all right? The problem with this test often lies in that if you have high T3 levels, let's say because you're being over-medicated or those T3 levels are elevated due to insulin resistance, prediabetes. It can lower your T4 levels, okay? So that's important. That's another important clinical pearl that you should be aware of. TSH, right? I like to see these levels between 1.8 and 3.0. Again, when combined with a complete thyroid panel, anything higher indicates hypothyroidism. And again, this is where sometimes things can get a little tricky, okay? Many patients can have a TSH less than 1.0. They can have 4, 5, 5.6, 6, 7.8 and up, and they can still have hypothyroidism. When TSH numbers are this low, okay, I'm also thinking about autoimmune Hashimoto's disease. So again, I think I may have said that a little bit wrong. When these levels are low, like 0.4, 0.5, 0.6, 0.7, 0.8, again, they're still within that range, 0.5 or 1 to 5.0. Again, when that TSH is low, I want you to think potentially about Hashimoto's disease, okay? So it's also important to remember that both T3 and T4 will cause your TSH to drop. So if you're taking any kind of thyroid replacement, the very fact of taking T3 can drop your TSH down, okay? We know that studies show that T3 replacement is 3 times more potent at decreasing your TSH levels than T4. So for all of you out there that are taking Armour, or you're taking Cytomel, or you're taking, Liothyronine, or anything Cytomel, or any of those T3s, that can suppress your thyroid gland, more so than taking Synthroid or levothyroxine. So again, something to keep in mind is if you have a low TSH and you're taking T3 replacement, Cytomel, Liothyronine, T4 thyroid replacement, such as Synthroid and levothyroxine, or any other medication, that can all lower your TSH. And that's one of the reasons why this TSH is so misleading, okay? One thing I like to tell patients is that if they have a high TSH, that when they start taking T3 or they start taking T4, if that's what they choose to do, one of the things that they should do is within maybe 2 or 3 weeks get a follow-up test. And one thing you should see right away is you should start seeing is that your T3 or T4 levels, as a result of taking those, is that your TSH levels should drop. So if you're taking any kind of thyroid replacement and your TSH is high, taking those should make your TSH levels drop. Okay, that's what you should see. If not, there's more problems. The next thing is thyroid antibodies. Okay, what you're going to notice here is that some labs, for their TPO antibodies, they go from 0 and they go all the way up to like 12. In some cases, they go all the way up to 35. Again, some will have a range, going up even higher. Some of the patients that I've worked with that are out of the country, these lab ranges are really high. But the point worth, excuse me, the point worth noting here is that any time that these antibodies go up, it's abnormal. Okay, you should never, ever, ever have these antibody levels elevated. Okay, one thing to keep in mind when it comes to and regarding autoimmune thyroid disease is this: is that when we talk about the immune system, there's what we call humoral immunity and there's what's called cell-mediated immunity, Th1 and Th2. Th1 is, again, the cell-mediated immunity, and Th2 is this humoral immunity. Even if your tests show non-existent levels of antibody productions, please keep in mind that you can have normal antibodies and still have autoimmune thyroid disease due to cell-mediated immunity. Okay, and that's very important. Let's talk about this. Let's talk a bit about some of the other lab biomarkers that are important to have done alongside this complete thyroid panel. Okay, I'll also say that there's a video that I did specifically on the thyroid antibodies that you want to look for and have done. So you can go back and you can just Google that. Dr. Hagmeyer, thyroid antibody levels testing that should be done. Okay, there are 6 additional lab markers that I like to run with patients when we know that there's a thyroid problem. Number 1 is something called sex hormone binding globulin. I believe this is especially important for both men and women. In women, it should be in the 70 to 80 range and can be very helpful in determining tissue levels of thyroid hormone. But it's also very important in understanding that this level, this sex hormone binding globulin, is typically elevated in women that are on birth control pills, okay, or really any kind of oral form of hormone replacement therapy, okay. Very important to understand because when the sex hormone binding globulin goes up, typically due to excess estrogen in the body, it's important to understand that too much estrogen will suppress your thyroid gland, okay, will suppress your TSH levels. So this is another reason why when a woman has a thyroid problem, she also, and she's taking birth control pills, you'll never fix the thyroid problem until you fix hormones, okay? Because again, there's again this crosstalk that goes on back and forth between the thyroid and the ovaries. Markers numbers 2, 3, 4, 5, and 6. These are markers, high sensitivity C-reactive protein levels, okay, or CRP levels for short. That's another marker that you want to have done. You want to have your ESR levels done. This is a marker for sedimentation rate. Again, it's a marker of inflammation. You want to have your ferritin levels checked. This is your iron storage. You want to have fibrinogen levels tested. This is clotting factors. It's also a marker of an acute phase reactant. And you also want to have your homocysteine levels. Okay, again, another marker of inflammation. Like I said earlier, elevations in these markers are indicative of an inflammatory response going on within your body. Again, these are known as acute phase reactants, and especially when it comes to the CRP levels and the ESR levels, you want to see these as low as possible. However, when it comes to fibrinogen and ferritin levels, very often in the case of inflammation, these will actually shoot up. Okay, again, these can shoot up because of infection, they can shoot up due to inflammation, and again, of course, as they increase, they too will they too will cause changes in your reverse T3 levels, and they will also change your homocysteine levels. So again, look for homocysteine levels that are less than 7.0. Now, the last thing we need to cover today are several conditions where the TSH can be called normal, but the patient can still, of course, be hypothyroid. Okay, so when you look at your blood work reference ranges, okay, you're going to notice that it's, of course, it's a pretty big range. It goes from 0.5 all the way up to 5.0, and again, some cases up to 6.0, and again, depending on where you live, there may be some room in there, wiggle room as well. So the point being here is that some of the common scenarios where the TSH is less than 0.5 or slightly above will include low thyroid syndrome or low T3, okay? That'll be one scenario that can cause that to occur. Another scenario is where we have a person who's had either a partial or a complete thyroidectomy. That's another scenario. A third scenario is where a person has Hashimoto's disease or they have autoimmune thyroiditis, okay? Insulin levels, leptin resistance, chronic inflammation, including chronic pain and rheumatoid arthritis, even fibromyalgia or chronic fatigue syndrome. These, again, are all scenarios, all right? Unfortunately, patients who fall into any of these categories tend to get misdiagnosed, and they tend to get mismanaged by providers who, again, rely solely just on that TSH. So as you can see, testing for hypothyroidism is so much more complex than just testing that TSH and that free T4. So I hope you enjoyed today's video. If you did, make sure you like it, make sure you subscribe to our YouTube channel. If there's a particular topic that you would like to see us do a video on, please leave that in the comment section. If you found value in this video, tell us that you like this video. And of course, if you're looking for more information in understanding your thyroid lab values, if you do visit my website, if you're watching this on YouTube, there is a section on my website where I put together a free guide titled The 6 Patterns of Thyroid Disease That Don't Show Up on Routine Blood Testing. And again, that goes into a lot more detail about some of the things we talked about today and also what those thyroid markers are used for. So it's a great kind of amendment to today's video. So again, if you're watching this on YouTube, again, I'll put a link in the description for today's video where you can find that download, and then, like I said, print that guide up and make use of it. Okay, so that's going to wrap up today's video. Hope you liked it, and we'll see you soon. Take care.